Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Smooth 98.1, love music, love life. Welcome. If you just joined us, you were just in time. It's time for Smooth Health. And of course, at the start of the show, I told you that I'm going to be having a very special guest join me in the studio today. Today, we're going to be talking about something very important that I think all women should be aware of. And also, of course, gentlemen out there should be aware of. So please, to be a part of our conversation, you need to reach out to us via the phone lines and also send us your WhatsApp messages. Now, you can call the number 0144899881 to be a part of our conversation this afternoon. And also, you can send us WhatsApp messages. Please send them to 0809-444-0981. Today, we're talking about maternal and antenatal care. And of course, like I mentioned, I have a very special guest in the studio to guide us through this conversation. Today, we're joined by Dr. Fatimah Habeebu-Adeyemi. She is an obstetrician, gynecologist, and certified gynecology surgeon with areas that interest, different specialties that include fetal medicine and also minimal access surgery. Now, she was also awarded the Ruth Griffiths Prize in Masters in Public Health from the University of Leeds, basically. And also, she's here to join us with this conversation and also lead us through this conversation this afternoon. Good afternoon, doctor.
Good afternoon.
Well, her resume is really long, so it's so yes. So if you're out there and you want to be a part of our conversation, please reach out to us on 0809-444-0981. Welcome, doctor.
Thank you.
Okay, so doctor, let's just dive right into it. So I'm sure a lot of people are wondering right there, who is an obstetrician and what does an obstetrician do?
Yeah, an obstetrician is a doctor who has subspecialized in the areas of treating mainly pregnant women. And with this, we mean the pregnancy and the baby inside the uterus.
Yes.
And they treat them for the normal cases and some complex cases. That's an obstetrician.
Okay.
Generally.
All right. So I'm also curious about this. Could you tell us some of the specialties and subspecialties of an obstetrician?
Well, there are arrays of specialties under obstetrics. We have the fetal maternal medicine. We have dealing with even getting pregnancy, where there's a gynae aspect.
Okay. And
we have taking care of congenital area, antenatals, that's pre-pregnancy. And we have the high risk. There are about, maybe as the question goes on.
Okay, you're going to unpack them for us.
Yeah.
All right. Okay, so guys, if you're out there one more time, the ladies out there, if you are, if you're having a baby at the moment or, whatever it is that you're planning on doing, feel free to call us and, send messages to our doctor. She's here to answer all your questions. Okay, so, doctor, please explain to us what maternal antenatal care is and why antenatal care is important during pregnancy.
Well, just basically, antenatal care is a special care provided by skilled healthcare professionals to pregnant women and adolescents in pregnancy in order to ensure the best health condition for both mother and baby during pregnancy until immediately after delivery.
Okay.
So this care can be given by, when I say highly skilled, they are trained in this field. They could be midwives.
Okay.
Could be family physician.
Okay.
The obstetrician. Then the fetal maternal clinicians. Like I mentioned earlier, the midwives are the nurses that are trained to take care of pregnant women. and family physician pass through this because they have to take care of everybody that come to see them. I've given you what an obstetrician is.
Yes.
And for the fetal maternal clinician, they are obstetricians that have further subspecialized in high-risk pregnancies. And when I say high-risk pregnancy,
yes,
I mean pregnancies that these are pregnancies that are being defined as either the mother or fetus are at risk of death, or injury, or they require additional resources or special procedures to optimize the outcome of the pregnancy.
All right. Well, thank you very much for that, Doctor. So let me circle back a little bit and ask, what is the role? Like, you've highlighted a few of them, but I'd like to know that what is the role of an obstetrician during pregnancies?
Well, the role of the obstetrician is to take care of both the mother and the baby throughout the pregnancy.
Throughout the 9-month period?
Throughout 9, yes. We see them at intervals to ensure that they have a healthy state throughout and transits into a positive labor with good experience at birth, and even to encourage solidify their esteem and competency subsequently afterwards.
All right.
There are components of what we deal with in antenatal care, which include risk identification, prevention and management of ongoing illness, maybe concurrent or pregnancy-related illness, fetal maternal assessments. Then we do health promotion, health education, and a shared decision. Make the whole process a healthy one, an enjoyable one, not like a pathologic, a disease condition. It's a physiological, normal condition, and it should be that.
All right, thank you very much for that, Doctor. If you just joined us, this is Smooth Health. It's brought to you by Evercare Hospital, right here on Smooth 98.1. Today we're talking about maternal and antenatal care, and of course we have with us Dr. Fatimah Habeebu-Adeyemi in the studio. She is an obstetrician, gynecologist, and certified gynecology minimal access surgeon with areas of interest in fetal medicine, gynecology, and minimal access surgery. And also we're having a long conversation concerning how women should prepare for maternal and antenatal care, generally from Evercare Hospital, amongst other things, and we'd love for you to be a part of our conversation. So, Doctor, we've talked about, the role of an obstetrician during pregnancies, and we've also talked about the subspecialties and specialties of an obstetrician. So I'd like to know this. What types of antenatal care services does Evercare Hospital facilitate, and what are the procedures involved?
Well, I'll first briefly tell you what antenatal care entails. It entails the pre-conceptional care, the prenatal care, the intranatal, that is during the pregnancy, and the postnatal care. Yeah. Normally, in a well-developed way, you're supposed to start from the preconceptional care, but majority of our women in this part of the world are not yet aware of that, but the awareness is coming up gradually.
When you say they're supposed to start from the pre, when is the pre itself?
Before pregnancy.
Before pregnancy?
Yeah, especially with women that have pre-existing conditions that needs to be optimized for better pregnancy period. So at Evercare, we prefer we can give everything, both from pre till post, but with the way we receive, it's a new hospital. So what we have presently is from the prenatal, intranatal, and postnatal. It's a continuum of care because there are different types of prenatal cares again.
I think you should break that down.
Yeah, all right. We have the standard one-on-one prenatal care, which can be given by the 4 categories of professional skills healthcare service providers I mentioned earlier. We have the group prenatal care. We have a subspecialty. This is mainly by the fetal maternal clinicians. And we have the multidisciplinary care. We practice more of the first and the last in Evercare. That's the standard one-on-one. And the multidisciplinary. So Evercare is hospital, a multidisciplinary hospital. We have virtually all the subspecialties. So even those coming, like I said, the preconceptional, if we catch them at that point, we can refer them to the appropriate department. If it's a cardiac condition they've got, if it is a renal condition, if it is hematology.
Okay.
So we have all the subspecialties that we optimize them up even before they get pregnant. And when they come in for pregnancy, during the pregnancy, like I mentioned, the components that we do in antenatal care, identifying risk.
Okay.
Anyone that is identified, we all manage together as a multidisciplinary team. Yeah.
All right. Tell you what we should do. Let's go on a quick break. When we get back, we'll do some more talking. I see messages coming in already. Don't forget to add your name to the messages and also let us know your location, because we're giving out vouchers courtesy Evercare Hospital. We're giving 3 people vouchers today. First 3 callers or 3 texters vouchers for your first consultation at Evercare Hospital. So the number to call one more time is 0144899981, or you can just send us a WhatsApp message. You can send the message to 0809-444-0981. Today, our conversation centers around maternal and antenatal care, and Dr. Fatimah Habeebu-Adeyemi is the one taking us through this conversation. We'll go on our break. When we get back, we'll do some more talking.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's
Smooth
awareness.
Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
There's nowhere on this earth that compares. Smooth.
Lagos jam.
Hey guys, my name is Rachel Kerr, and let me tell you about my Lagos. There's nowhere on this earth that compares. From mainland to island to the roadside soya, there's nothing like that. And of course, the sweltering heat from morning till evening. Now in my Lagos, nothing compares to the weddings. Nothing compares to our parties. But one thing I will say is there's nothing like reaching your land of Lagos. My Lagos, your Lagos.
Okonkwo and his family worked very hard to plant a new farm. But it was like beginning life anew, like learning to become left-handed in old age.
In the world of books and literature, Smooth 98.1 presents to you the very best of African authors.
I'm a storyteller, and I was also
African stories and perspectives with a mix of prose and poetry, drama and thriller, fiction and reality.
I write about things I recognize.
It's 1 hour of inspired literature on the Smooth Book Review. Every Saturday from 10 a.m.
Music is about soul healing vibes that transcend you with lyrical grooves, lifting you into love as you flow through. Life, my music is frequency 98.1. Love music, love life. You're listening to Mind Muse.
Smooth 98.1, love music, love life. It's 5:32 by my time. If you just joined us, well, you're just in time still. You haven't missed too much. You've missed quite a bit, though. We're talking about maternal antenatal care. And, of course, we have a very special guest. That's Dr. Fatimah Habeebu-Adeyemi. She's here leading us through that conversation. Like I mentioned before the break, you can get your questions in, okay, to the number 0144899981, and also you can send a WhatsApp message to 0809-444-0981. We're giving out vouchers to our first 3 callers or texters on the show today. So I've got a message here from Aisha from Ajah. She says, top of the moment to you, doctor. My question is with regards to consistent genital infection during pregnancy after several antibiotics to treat it. It keeps reoccurring. What can be done to protect the mother and the unborn child?
Wow, Aisha, sorry about that. In the pregnancy periods, there is a lot of hormone progesterones in the system, so it's a sort of normal thing for you to have more vaginal discharge during this period. And normally we ask if it's not symptomatic, it's not itching, it's not painful, there is no discomfort, we watch it. However, if you now start having symptoms, then it needs to be treated. You can call to book an appointment to see me. Then I'll do a proper evaluation and give you the tips on what to do.
All right. Thanks so much for that, doctor. We've got a call here. Let's see who this is.
Hello.
Hello. Good afternoon.
Good afternoon.
Hi. Good afternoon. What's your name, please?
My name is Ghania Mustafa.
Ghania Mustafa. Do you have a question for our doctor today?
Yes, I would like to know what's the main cause of maternal risk during pregnancy?
High maternal
risk during pregnancy?
Yes.
All right.
Yes.
Okay. Thank you, Ghania, for that important question. Well, like I said earlier, we need preconceptional care before pregnancy. A woman before pregnancy, the state of the health would determine the condition in pregnancy. So before getting pregnant at all, we need to be healthy. And even after pregnancy, the health habits will predispose the woman to certain risk. That's why even at antenatal care, we have antenatal sessions where we counsel the woman, we teach them things they shouldn't do, things they should avoid. So your pre-pregnancy morbidity state will dictate the risk of your pregnancy. If you have heart conditions, then you are a high-risk patient. If you have diabetes, you'll be a high-risk patient. And some people, due to the type of pregnancy, multiple gestational pregnancy, when they have twins and other higher, it increases them. Then the age of the woman, too early, adolescents downwards, and the elderly pregnancy also predispose them to having higher risks. Then conditions that have happened to the same woman in previous pregnancies can predispose the woman to be a high-risk pregnancy. So they are bound. That's why it's very important to come in earlier before pregnancy. And if you are already pregnant, at the early stage of pregnancy, you come in and a detailed baseline history-taking, investigation, examination, screening is done so as to allocate you either to the high risk or the low risk. If all these ones are done very well, I think even if the lady is a high-risk pregnant woman, can be properly managed and outcome really optimized.
All right, thank you for that, doctor. Got a message here from Fatima. Got a message here. It says, hello, Dr. Fatima. Is brown discharge lasting up to 3 weeks during the second trimester normal?
Any discharge that's discolored needs to be evaluated, especially when you say it's brownish. That means it's a little spotting. So it needs to be evaluated. As a matter of fact, I'll advise you, since you are in your second trimester, to please see your obstetrician for that to be dealt with appropriately.
All right.
It could be a sinister sign.
Okay, so doctor, let's talk about antenatal appointments. But before we do that, someone's calling our phone. Let's see who this is. Hello.
Hello.
Hello. Good afternoon.
Good afternoon.
Yeah. Good afternoon. Thank you very much, Dr. Fatima. My name is Ghania Mustafa.
Yes, go on, please.
Okay, you have really answered my questions. I would like to know, if we want to book an appointment with you at your clinic at Evercare, how do we go about it?
Kayode will deal with this.
We'll give you the details at the end of the show, but you have to listen till the end, which is at 5:45, 5:50. So listen till the end of the show, and we'll give you the details of how to reach out to her.
Thank you, Ghania.
Okay, thank you very much.
All right. Okay, so if you've got questions for our doctor today, please reach out to us on 0144899981. If you just joined the show and you're wondering what conversations we're having. We're talking about maternal and antenatal care, health. And generally, like I mentioned, Dr. Fatimah Habeebu-Adeyemi is leading us through that conversation. So, Doctor, real quick, let's talk about, antenatal appointments. So how many antenatal appointments are expected before a baby's delivery?
Good. Well, antenatal appointments are not fixed. In the past, we used to have the traditional antenatal appointments, well, initially 8, then it became a time WHO brought up focused antenatal care, which was supposed to be 4 visits for the normal, that's pregnancy without any complications. But recently there have been setbacks that have been found out on that.
Okay.
So there is no a rigid, it's not rigid anymore. However, based on studies for different places determine there. Here in Evercare, we have 15 antenatal care.
15?
Yes, if you register at a very early stage. And another principle that is basic, WHO, everyone, is the traditional one. If you register very, very early in the first trimester,
yes,
you are seen every month. That's 4 weekly, till you are
4 times weekly. That's once every week.
4 times. Sorry, I made a mistake. You are seen monthly. Let me say monthly.
Okay.
Every 4 weeks.
Every 4
till
weeks.
you are 28 weeks.
Okay.
Then you'll be seen fortnightly, every 2 weeks, till you're 36 weeks.
Okay.
And from 36 weeks, baby can come. You'll be seen every week till you deliver or till you have a planned delivery. Yeah.
All right. Well, that's a lot of appointments.
So from that's where we got our 15 from, if you start very early.
All right.
Yeah.
Okay, so let's talk about high-risk pregnancies. And I know you've addressed this earlier, but for the people that just joined the show, that weren't able to catch it, what makes a pregnancy high risk? And also, I'd like you to circle back and talk about the benefits of, antenatal care for a mother and a baby.
All right, good. Like I said earlier, high-risk pregnancy has been defined as pregnancies in which the mother or the fetus is the baby inside, or the newborn baby is at risk of death, excuse me, is at risk of death or residual injury,
okay,
which will require additional resources or procedure or special care to optimize the outcome, so that at the end of the day, mother, baby, everybody is healthy.
Okay.
And this can be predisposed by chronic health condition, such as serious acute disorders, previous pregnancy conditions, or ongoing or concurrent pregnancy-related conditions. And antenatal care is done to identify this risk earlier on in time.
Okay.
Yeah. And give appropriate intervention to abate it or alleviate it, remove it completely. Then for maternal and fetal assessments, then ongoing evaluation of the pregnancy, then you anticipate for issues that can arise and intervene early. Finally, you do health promotion, health education.
Okay.
You support the mother, and you have a shared decision. As in, you discuss issues. The patient is always the head of the team. For the doctor is to give advice on every options available that will help the patient. The patient makes the final decision. That's what we do. You give them the best options,
and then they make the decision that they want to go.
Yes, informed decision. So this is it.
Let's see what this caller has to say. Hello, good afternoon.
Good afternoon.
Hi, good afternoon, sir.
Good afternoon. My name is Imam, calling from Lagos Island.
Imam from Lagos Island, welcome to the show. Do you have a question for our doctor today?
Yes.
Can you please go on, Imam?
Okay, I want to ask, how do you prevent bleeding after giving birth? I lost my very good friend 6 months ago, and now as a result, then few months later, the same thing happened, but we didn't lose her anyway. But it happened that night, there is actually no blood in the hospital before they could move her to the other hospital that then she can be taken care of. We lost her. But this time around, we were able to get something on the call hand. So how is there anything that could be caused or that somebody can do to prevent this or another?
Thank you very much, Emmanuel. I believe what you're talking about is what we call postpartum hemorrhage, bleeding after delivery. Is that what you're saying? Yeah. This is one of the leading cause of death in pregnancy, especially in this part of the world. And that's why antenatal care is here to take care of that.
Okay.
A woman that have registered for antenatal care should have less chances of bleeding to death. Even if we've done everything, the chance is still there. But during the antenatal care, she's evaluated, and there are some predisposing factors she may have that would have been dealt with. And before a woman, or when the woman goes into labor, in any good place, there should be blood ready on ground. And the skill of the people taking care of the labor should be ready to take care of any bleeding, to stop any bleeding. And if that goes so much, the obstetrician is there to intervene, to either do surgical procedures that will stop the bleeding, and why they also need a blood bank where they always have blood, because every labor cannot be said to be normal until after the baby has been delivered and everybody is okay. So it is always been anticipated. So all this care that are given at the different stages, we have three trimesters of pregnancy: first trimester, second trimester, third trimester, are done in order to prevent such occurrences. So please, if you have any pregnant woman, let them register earlier on time so that these risk factors will be identified and dealt with, and things will be put in place to prevent them.
All right. Yeah. Thank you very much for that, Doctor. So Ima and also Ghania Mustafa, well, you are our first two callers, and you've won yourself vouchers, for free consultation at Evercare Hospital. So please send us your details, and I'd love for you to send them right now to 0809-444-0981. I'll say that again, 0144-89981. We're giving our first three callers and texters vouchers, for free consultation, for their first free consultation, of course, at Evercare Hospital. By the way, this is Smooth Health, and it's brought to you by Evercare. And Doctor, just before we wrap up, because we're almost out of time, let's quickly circle back and, talk about another caller. Let's see.
All right.
Hello.
Hello.
Hi, hello.
Hello, good evening.
Hi, good evening, sir. How are you doing?
I'm fine. Name is Oluwaseun.
Oluwaseun, do you have a question for the doctor today?
Yes, please. I want to ask for a lady that has a condition of fibroid. And and the husband and wife intend to have a baby in the next few months, but she has fibroid right now. So what do we do about that?
All right, thank you, Oluwaseun. Actually, fibroid on its own may not prevent pregnancy. Pregnancy can coexist with fibroid. It depends. There are a lot of things you look at. It's only if she's not getting pregnant and other things have been ruled out that can prevent pregnancy that you can say it's the fibroid, because you have to deal with the size of the fibroids, the location of the fibroids, before you can say, okay, this is what is causing infertility. I don't think if you are just trying. However, she still needs to be evaluated so that we know that can you conveniently go on with this, because sometimes if they are very big, they have their impact on pregnancy, even if you get pregnant. Yes. So she needs to be evaluated. That's the preconceptional care and appropriate advice given for how to optimize the pregnancy. Thank you. Okay. I hope I've been able to answer that.
Based on what you said, another doctor said it's advisable for her to get pregnant early, then we can do the fibroid, or I don't know.
Yeah, that's why I said it depends on the size. I don't know the size. You are just saying fibroids. Fibroid can be from a pin or even not seen by the naked eye, so as big as a 9-month baby. So yes, and people have carried fibroid with baby, and another very important thing, it doesn't even depend on the size. Sometimes the small fibroids can cause issues, while the big one does not. So she really needs to be evaluated properly, investigated, and given appropriate advice. Thank you.
Hi, Oluwaseun. Thank you so much for calling. I will take one more call and then wrap up this side of the show. Hello?
Hello?
Hi. You're a final caller today.
Yes, no, this is Mustafa Ghania. I didn't get the number you called very well.
Okay, let me say that to you slowly. 0809
Yes, sir.
444
444
0809 444 0981.
8 what?
0981.
Okay, so I'm supposed to send my...
Just send your you know what? Please listen to the show. So I'm going to talk about it again.
Okay. Thank you.
Let's see if we have the last caller that wants has an actual question.
All right.
Hello.
Hello.
Hi. Hello.
Yeah, good evening.
Good evening.
Yes, this is Teddy.
Hi, Teddy.
Yes. Okay, so it has to do with fibroid. I know it might be a bit vague, but I just want to ask. A lady or a woman who successfully has, fibroids removed, is there a possibility it could still, that's assuming there are no other conditions inherent, is it possible that it could still cause infertility or prevent pregnancy from happening?
Thank you very much for that. A lady who has the fibroid removed, I presume it's done in the right place with proper skills and everything, because if it is removed and the aftermath effect of the removal is because there are some fibroids as gynecologists will see, we don't even touch it.
Okay.
Yeah, so if done properly, it shouldn't. However, if not done properly, it can still, the effect of that removal can still cause, there is additions, what we call additions, the uterine walls is fixing together, or there are kinks and everything, it could still cause a little issue. So please, let's do it in the right place. And I'm so happy, I'm glad that there are more men calling in than women. Aisha called and Ghania.
Yes.
But Teddy Shemun and
yes, Teddy and Show. Well, it's good there's a balance to it.
Yeah.
Okay, so real quick, I want to just add these two last two questions because we're totally out of time. So, do obstetricians, do they perform surgery? That's the first question. And also, does Evercare have any special packages for new moms?
Thank you. I was going to wrap up with that. Yeah, any obstetrician is a surgeon. The cesarean sections we do, they are surgeries, and there are times you even have to do a gynecological surgery, that's cesarean hysterectomy, you have to remove the uterus. So all obstetricians are surgeons. That's why even if you are going to non-obstetrician for your pregnancy, it's still better you let an obstetrician over supervise.
Okay.
Yeah. So that in case you run into incidences that will need surgical intervention. Then also, coming to Evercare, we have a nice package. Evercare Moms Community.
Okay.
It's to enroll in Evercare Moms Community. You either have to register for our antenatal class, or you are seen by our pediatrician. You automatically become a member.
Okay.
And this give you some benefits like discounts in 5% discount for the antenatal care, and discounts in some partner organizations. We've partnered with we have Baby Lee's and some other one, and we have antenatal classes every second Saturday and the last Saturday of the month. And this partner organization coming to give some features apart from the teachings on the antenatal classes. Like we've had yoga, we've had Pilates, we've had Murphy's coming to showcase their huggies, and this continues. So, and it also create a community of mom to meet and discuss, share discussion amongst themselves. And if you deliver at Evercare on your way out, excuse me, you have a delivery package which contains some goodies for you and your baby.
All right. Nice. Well, that's I wish we had so much time to still continue, because there's so many questions I still want to ask you. But for the people out there listening, how can they reach out to you at Evercare Hospital? And how can they reach out to Evercare in general? How can they locate Evercare Hospital?
Well, good. Just what I used to tell my people, anybody that if you just Google Evercare, it brings out our website, our contact number. However, we're on 1 Admiralty Way, Bisola Simi 80 Drive, Lekki Peninsula, and our Our website is www.evercare.ng. The telephone number is 0813 9850-710, and you can always email us for information on info@evercare.ng.
All right. Thank you so much, Doctor. Once again, it's number 1, Admiralty Way, Bisola Durusimi Eti Drive, Lekki Peninsula, Scheme 1. And also the website is www.evercare.ng, and the phone number to reach out to them is 081-398-50710. Okay, so I'll say that again, 081-398-50710, and you can send an email to info@evercare.ng. Thank you so much, Doctor. It's been a pleasure having you here.
Thank you. It's been a pleasure being here.
And I look forward to having conversations with you concerning this and other things in the coming weeks.
Thank you.
All right, Lagos, there's more to come, so please stay with us. Don't forget, we are the smoothest dial on Lagos Radio. This is Smooth 98.1. For the callers, let me reiterate this again. You've won yourself a voucher for your first consultation at Evercare Hospital. So, Ghania Mustafa, Ima, Oluwaseun, and Teddy, please send us your details. Send them to 0809-444-0981. Okay? 0809-444-0981. This has been Smooth Health, brought to you by Evercare Hospital.
This is Smooth Health on the Drive.
A global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.